Cold and heat emergencies. Extreme hot or cold environments can be dangerous. Many injuries caused by temperature extremes begin gradually, but if they're not recognized and treated, they can become serious emergencies. Exposure to cold temperatures can cause several medical emergencies. Frostbite is the freezing of skin and other tissues. Exposed skin on hands, face, and feet are the most common areas affected. Look for these signs. Skin looks waxy and white, gray, yellow, or bluish. Feels numb, tingly, or achy. When severe, the area feels hard, may become painless, and after warming, become swollen and may blister. First aid for frostbite depends on its severity. The first thing to do is get the child to a warm environment and remove any wet or constricting items. For minor frostbite, gently warm the area with skin-to-skin contact. Use your hands to warm the frostbitten area or put it in contact with another warm body part, like the child's armpits. For severe frostbite, seek immediate medical attention. If help will be delayed and there's no chance of refreezing, you can warm the affected area in lukewarm water for 20 to 30 minutes. After the area is warmed, place some dry gauze or cloth between frostbitten fingers or toes. But it doesn't have to be freezing for a cold emergency. Hypothermia is a condition caused by abnormally low body temperature. It can occur outdoors or indoors, and the onset can be gradual or quick. If left untreated, hypothermia can become life-threatening. Here are the signs and symptoms: uncontrollable shivering, lethargy or confusion, clumsiness, drowsiness, altered breathing, and changing responsiveness. To treat hypothermia, first check responsiveness and breathing and call 911. Except in mild cases, the child needs immediate care. Provide CPR if the child is not breathing normally. Quickly move the child out of the cold and remove any wet clothing. Warm the child with blankets or warm clothing. If and only if you are far from medical care, use active rewarming by putting the child near a heat source and putting warm water in containers against the skin. Do not rub or massage the skin, and be very gentle with the child. Give warm, not hot drinks to an alert victim who can swallow easily, but do not give caffeine. Monitor the child's breathing and be ready to give CPR if needed. Emergencies can happen when a child becomes overheated. Heat cramps are caused by activity in a hot environment. Leg and stomach muscles are most often affected. Signs and symptoms of heat cramps are muscle pain, cramping, spasms, and heavy sweating. Have the child stop activity and sit quietly in a cool place. Give the victim a carbohydrate electrolyte drink, such as a sports drink, to promote rehydration. Other beverages, such as 2% milk and coconut water, are also effective. If a carbohydrate electrolyte drink is not available, give the victim water. Stretch, ice, and massage the muscle. Prolonged activity in a hot environment can lead to heat exhaustion if the child doesn't get enough fluids to replace what is lost through sweating. Signs and symptoms of heat exhaustion include heavy sweating, thirst, fatigue, heat cramps, and later may include headache, dizziness, nausea, or vomiting. It is possible for heat exhaustion to develop into heat stroke. To treat heat exhaustion, first move the victim out of the heat. Lie them down in a cool place and loosen or remove outer clothing. Next, give the victim a carbohydrate electrolyte drink, such as a sports drink, to promote rehydration. Other beverages, such as 2% milk and coconut water, are also effective. If a carbohydrate electrolyte drink is not available, give the victim water. Lastly, cool the victim with a cool water spray or wet cloths on the forehead and body. Unrelieved heat exhaustion can lead to heat stroke, which is a serious medical emergency. The other heat emergency is heat stroke. Signs and symptoms of heat stroke include skin that is flushed and hot, and sweating has usually stopped. headache, dizziness, confusion, irrational behavior, rapid breathing, and possible convulsions or unresponsiveness. Heat stroke is a true medical emergency. Dial 911 immediately if there are signs and symptoms of heat stroke. Move the victim to a cool place. The best way to cool a heat stroke victim is to immerse them up to the neck in ice water. If this is not possible, cool the person down by any means possible. If immersion in ice water is not possible, take the victim to a cold shower or move to a cool area and cover as much of the body as possible with cold, wet towels. Do not try to force the victim to drink liquids. Be sure to monitor the person's breathing until help arrives, and be ready to give CPR if needed.